At Exeter Health Resources, we are absolutely committed to the highest standard of quality and patient safety. And one of the foundational activities that we can do is wash our hands fastidiously every time we see a patient and every time we leave a patient.
We don't realize in the course of a day how many of things we lay our hands on. We may lay hands on our patient to do a physical exam, but we use a lot of tools in caring for patients, be it a stethoscope, an otoscope, etc. And after you've handled these things, it's extremely important to wash your hands.
So there's a variety of infections that we know are transmitted within the hospital setting itself. Things like MRSA, things like C. difficile colitis, things that truly affect the well-being of our patients that are preventable, and preventable mainly through hand washing and other good hygiene techniques that we take care of in the hospital.
We think about preventing the spread of an infection amongst our patients. It's equally important to think about this as a way of preventing spread of infection amongst our healthcare workers.
And the campaign today is about how do we as a group hold ourselves accountable for washing our hands, because if there's one thing we can do, it's to wash our hands effectively for our patients and for ourselves.
With the amount of care that we deliver in a typical day, it is going to be an extensive amount of times that a healthcare worker probably washes their hands. Some would say close to 100, and that's probably accurate.
Surgeons may wash their hands in a very particular way, but what we're really talking about is a uniform way to wash your hands for at least a period of time that we're able to eradicate most of the germs and the other things that are on your hands that could be spread. The easiest way is to foam in and foam out every time you see a patient. They're located almost everywhere.
And they are quick and easy. And it's a very reasonable alternative to washing with soap and water, and in many instances does better and is less caustic to the skin.
And if you don't see one, we'd like to know about it so we can have accessibility to this all the time.
It's extremely important that you have a technique, because otherwise it's so easy to miss a portion of your hand that's extremely important and probably carrying germs.
You always want to be thorough. You want to wash your fingertips, around your nail beds, over the top of your hand. You want to make sure that you're in between your fingers. Of course your palms are included, and you want to make sure your wrists are included as well.
The exceptions to that include certain infections. So hand sanitizer actually isn't effective against certain infections, one of them being Clostridium difficile, which is one that we do worry about in the healthcare setting. If your hands are visibly soiled, you really should wash your hands with soap and water. You want to make sure that you're getting hands wet, soap covered over your hands, that you're not forgetting the thumbs or in between the fingers, and you can sing a song to yourself.
Sing happy birthday, say the ABCs.
To remind yourself of how long it should take, but roughly it's about 15 to 20 seconds.
You want to make sure that you're always rinsing hands down. When you dry off, you use a towel to shut off the tap. It all is a comprehensive way to make sure that there's no more microbes left on your hand before you see a patient.
So when you enter into a patient room, it's important, if you haven't just done it coming into the room, that you do wash your hands.
Always remember to use alcohol wipes for your stethoscope when you listen to the chest or heart of a patient. It's just best practice.
A lot of times we keep instruments contained into a certain room for a patient for their duration of their care, but in between episodes of examining patients with that instrument, it is important to sanitize them as well.
One of the things that might not be so obvious to us is that when you wash your hands and then see a patient, and you come in contact with a body fluid, whether it be tears, sweat, blood, you change a device like a Foley, that also requires us to wash our hands again.
It's important that if you've gloved and you've been handling dirty, potentially soiled instruments, that when you take off your gloves, you wash your hands again. Because in the process of taking off your gloves, you're likely dirtying your hands. Whether you visibly see it or not, they're likely contaminated.
We need to use the best practice ways of cleaning your cell phones, your badges, and any other fomites that you might find. And of course, after all, when you leave the room, you wash your hands one more time.
It's equally important in the outpatient setting. One, for the patient to understand that we view it as being important. So if it doesn't visibly happen in front of the patient, we really want the patient to feel empowered to ask us if we've washed our hands, and for us to respond to that in a way that is comforting to them so that they're understanding the question isn't outlandish. We want to make sure they understand that we see it as a priority. Whether we've done it before we stepped into the room or while we're in the room we've done it, we want the patient to know that it's happened. Certainly if it's top of their mind, it should be top of our mind. And it is the single most important way we can help prevent infection spread.
We deliver care in a team-based manner, so absolutely everybody is accountable for this. From environmental services to food services, our technicians, our nurses, and our physicians. So everybody has to feel empowered to be able to say to our colleagues, if they see that we're not washing our hands, that that's what we expect from each other. And I think that that is an essential component of this campaign.
We're all partners in care here. The patient is part of the team. If they don't feel empowered to be able to ask us about something that's very important for part of their care, we're not doing our job. And certainly if somebody were to come forward and ask if we'd washed our hands, our response to that should be, I did, or I didn't, or oh, thank you for reminding me.
All of us are accountable for hand washing. It's the one thing we can do together to protect our patients.